And to learn more about the latest COVID-19 situation here in Indonesia, we are now connected with Mrs. Siti Nadia Tarmizi, Indonesia Health Ministry spokesperson. Good afternoon, Madam Siti Nadia Tarmizi. Thank you so much for joining us again on the 3-Hour News Show. Now, Madam, we know that we enter the third wave. Somebody said that we are already in the peak, but some other says that we are still, paving up to the peak. Now, the number of positive COVID-19 cases continues to increase. We saw yesterday there were 9,163 active cases, and then the day after, it was 2 days ago, and then yesterday was 12,000, and I heard today was down to 10,000. Hopefully, it is going to be decreasing. With the Omicron variant especially accelerating the spread, what are the government's course of anticipation to curb the spread this time?
Yeah, so I think regarding the increasing of the COVID-19 cases, it will be happen across the countries. Yeah, we can see some many countries already experiences with this. Either because of Omicron or potentially with other variants. But we need to prepare because like the third wave, it might not preventable. So today, it looks like the number of cases is decreased to 10,000, but still it's a quite amount of big number for COVID-19. And of course, we have again already aware about the situation since I think in November we heard that there is a new variant, what we call it Omicron, and we seen on the end of October, November, there is a lot of countries who have increasing the number of the cases because of the Delta variants or even with other variants. And we can see now like in Asia, like Singapore, Malaysia, India, they are starting to experience with this increasing of the cases. So what we already plan in terms of facing this third wave, the first thing we need to activate. We activate all we already have during response in the Delta variant in June or July last year. So again, we are strengthening our COVID-19 task force at all level, including at the village level, even at the province, at district. So we need to activate all these COVID-19 task force. Second one, we accelerating the primary vaccine and the booster vaccine. Currently, we still prioritize in terms of meet the target for primary vaccine. But along with this, our current policy that we already allow all the districts to conduct a booster vaccine. It's not depends on their achievement on the first vaccine target or their target in among elderly. So any districts and cities can start the booster vaccine in terms of accelerating to prevent the Omicron or maybe the third wave of the COVID-19. And the other things, we are adding more centralized isolation. Besides that, we provide telemedicine for the patient who have conduct the isolation in their house or in their home. So in terms of the case of the COVID-19 currently, mostly is they are positive, but they have very less symptoms or even they don't have any symptoms. So we encourage this patient to have isolation at their house because we know that with the number that keep increasing, the health facility might not sufficient to take all, especially positive cases. So we need to prioritize in terms of mild or severe cases to be taken care in the health facilities.
All right, ma'am. So this is Hans speaking. By the way, according to what you were just saying about the home isolation, because we are not encouraging the mild symptoms to go to hospital, to give the facilities to those people who might feel the severe symptoms. But on that note, the bed occupancy rate, how many are available at the moment?
Yeah, if we can see, in fact, is the patient who currently hospitalized is not in the term of mild or severe condition. So mostly like 80% is very mild, yeah, or we can say it's very very small disease, symptoms that are currently hospitalized. So if we see at the national level, our bed occupation rate is about 11%. Yeah, but it's based on the current bed that available, because like I mentioned during Delta variant, we are able to add twice more this bed occupation. Uh, Due to the very low number in September, October, mostly this bed at the hospital are confirmed again for other diseases, not only for COVID-19. So, of course, it's almost reducing half of the bed availability currently. But in terms of the increasing number of COVID-19, of course, again, we have another scenario to convert this situation, especially in the hospital. Again, the bed that dedicated for COVID-19 should be reconfigured again to be available for the patient.
Okay, now, ma'am, actually children and also teenagers age 6 to 18 years old made up 10.2% of the COVID-19 cases in Indonesia. Now, also 12.7% are actually receiving medical treatment, or they are actually under quarantine. Now, are there any differences in treating adult and also pediatric COVID patients in your point of view?
Yeah, I don't think there is a difference, yeah, in terms of treating the patient, either they are children or adult. In fact, either they have Omicron variants or they have another variant such as Delta. There is no difference in terms of treating the patient, because we know we don't have yet the drugs for COVID-19. Mostly we are only provide treatment in terms of the symptoms, and what the current information we have, mostly the severe case among children due to.
All right. We're still waiting to be reconnected with
Madam Siti Nadia
Madam
Tarmizi.
Siti Nadia Tarmizi in this case.
Okay,
And
so it's
also,
a very good explanation from Madam Siti. Then again, we're still waiting for her to be reconnected with us. As I told you guys already on the previous timing of the show, that actually it's not just adults and also pediatric patients are actually increasing to this Omicron variant. So again, it's not just actually implementing the three W's that we know already, because sometimes to shield the children is a bit hard, right?
This is actually one of the concerns from the parents, as we talked about it before. And there was actually no release yet from the Ministry of Education about this, and also from the Ministry of Health. When people are actually expressing their worry about this whole thing on school clusters. And also, meanwhile, while we're waiting to be reconnected, there's actually an update in Bogor. The local government has suspended in-class learning as the Omicron variant emerged in the city. The city's disaster management agency also disinfected a school after COVID-19 cases were detected. 40 cases have been reported so far.
Apart from suspending classes at schools, the local COVID-19 task force has imposed restrictions as a preventive measure against the variant.
And the total number of cases in Bogor has climbed rapidly over the last 3 weeks, reaching 120 daily cases by January 30th.
Kita sepakati untuk menunda PTM di semua tingkatan, ya karena angkanya tinggi sekali, 45 di seluruh sekolah dan kemungkinan akan menyebar. Dan klaster terbesar di Kota Bogor ini adalah klaster keluarga dan luar kota. Jadi kalau anak terkena di sekolah maka akan membuat ledakan di klaster keluarga. Dikhawatirkan akan menulari lansia yang punya komorbid dan lain-lain. Dan kita juga menyepakati untuk menahan atau mengingatkan pada warga untuk tidak berkumpul di keramaian dan lain-lain, menutup pedestrian SSA untuk akhir minggu, menutup tempat-tempat taman-taman di Kota Bogor dan mengawasi secara ketat mal, tempat hiburan dan lain-lain. Sampai jangka waktu yang tidak ditentukan, ya sampai lonjakannya kemudian kembali melandai. Vaksin anak-anak sudah full dan semua sudah diberikan booster untuk guru dan pendidik.
All right, now we are connected again with Madam Siti Nadia Tarmizi, the spokesperson of COVID-19 from the Health Ministry of the Republic of Indonesia. Now, Madam Siti Nadia Tarmizi, let's continue the interview. So we were talking about vaccination as well as treatment for kids as well as adults who are vaccinated or maybe not vaccinated. Now, when we see parents handling the children who get COVID-19, what could they expect to see in the COVID-infected children, and what kind of treatment do they need to have? Also, whether it is safe enough or wise enough to actually send the kids to school, even though most schools are now open for 100% in-class learning.
Yeah, I think firstly regarding the opening school, it's already regulation regarding how conduct the offline school currently. Yeah, of course there is a certain criteria. For example, how you maintain the health protocol, and I'm sure about all the activities should be implement the health protocol, and of course there is if there is a case in the school, we have to again check and testing all the kids in the school. So we know that the possibility to get infected is not only during the school. The children might get infected during their other activities. Yes, it's not only the school. Of course, again, they choose whether parents would like to send their children to go to school or not. It depends on the parents, especially in this condition when there is increasing number of cases and certain conditions, certain criteria, and certain effort in terms of reducing the case or prevent the case in the school already have the guidelines. So hopefully this guidance can be implemented, so we can monitor whether if there is a case, it should be, for example, closing the school, or we need to shut down only for like 2 or 3 days, something like that. And of course, within this policy, we already try to accelerate the vaccination among the children 6 to 11 and 12 to 17 years old. Currently, I think it's like almost 90% already got the first jab, and like 50% for the children between 6 to 11 years old. The main challenge may be how to ensure the health protocol really implement very well during school period, or even after school period. For example, how we prevent there is mass gathering during after the school, and to make sure our children are directly go to their house after finishing the school.
Now, let's say, ma'am, in Jakarta is the most city or the most area where the Omicron cases. With that being said, will the in-class learning in Jakarta be stopped when it comes to the numbers of the children infected by the COVID-19?
Yeah, currently that policy has not been yet decided. Yeah, although we know like 50% of the national cases comes from the Jakarta cities. So when we have like 10,000 cases, like 4,500 is coming from Jakarta. But during this period, although we found more cases, the number cases among children is like only 10% till 50%. So it's not contribute a lot, or although we have several school cluster, but it's not really very small percentage. Yeah, school who really become like a cluster. Other, it might already some cases, but it's only like 1 or 2 cases. So with this condition, of course, I think the local government and the central government are monitor the condition. Once we might have a number of cases are really increasing, and we need to apply what we call it the PPKM at the same level across province and district. It might be the offline school might be conducted too. So currently, it's not been yet decided because we seen the situation do not necessary currently to change from the offline to the online school.
Dr. Siti Nadia Tarmizi, spokesperson of the Indonesian Health Ministry, thank you so much for your elaborative explanation today. And I hope we will look closely to the updates that will be given by the ministry. Thank you so much.